45-year-old woman comes to office to discuss her facial asymmetry. For the past 6 weeks, the right side of her face has been progressively weakening. The patient noticed there are fewer wrinkles on the right side of her forehead than on the left, and the fall in front of her cheek seems less deep. Sometimes she has spasm of the right side of her face, and her right eyes feel gritty like there is sand in it. She is unable to hear finger rub on the right side, edema and erythema of conjunctiva on the right. There is asymmetry between left and right side of her face at rest, little movement of right side parts of the face, including the forehead, incomplete eye closure of the right side. Which of the following is most appropriate next step in diagnosis? We could see, Shabab, this case is having facial asymmetry, but important thing to notice in this scenario is hearing loss. She is unable to hear finger rub on the right side. In addition, the problem was more of prolonged time, so she has 6 weeks of this problem. In this case, we need to think of tumor that's compressing the facial nerve. So it is not a simple palsy or just a facial nerve palsy, but there is a red flag. You could see in the note that red flags in unilateral facial weakness, further investigation is needed, include sparing of upper face or focal neurological deficit. Brain MRI is needed for suspected stroke in these cases. If there is tick exposure, skin rash or flu-like, in which we need to get Lyme serology because Lyme disease can cause facial nerve palsy. And the third here, which is our case, hearing loss plus minus vertigo, MRI skull base for suspected tumor, limb weakness and decreased reflexes will need lumbar puncture for suspected Guillain-Barré syndrome. If one of these red flags are present, we need